the last time we talked, we ended up with the wow factor, where clients were coming out of the room. I would be literally in the room, um, right there next to you, and the clients that were coming out after a session with you, um, after y'all had done an EMDR session, were stating, wow, that was amazing.
Yeah.
And also they were stating, I'm so tired. It's exhausting.
Yeah, it's workout.
Yeah, it's really, really tiring for them, but they're amazed. And I'm sitting there and getting engaged in the conversation that you're having as you're saying goodbye, and we're all chit-chatting, and they are just, thank you so much, that was amazing. So I want you to explain this wow factor thing. What is this? What happens that you think people have that response?
So a few things.
Okay.
One thing is we have to remember that they are going through a simulation of sleep almost. Meaning they're simulating the same thing that they're doing when they're sleeping, and that's they're going through a REM cycle, an EMDR.
So they're like, and we've actually talked about this before. So they're going into like a dream state.
Well,
and REM sleep.
It's a REM cycle, but it's fully conscious. Okay, so when you're going through a dream state or a REM cycle in your sleep, you're not conscious. And so there's a difference there, right? So the brain is still doing something relatively similar in that it's simulating a REM cycle, but you're fully conscious and fully aware and fully present, okay? Now, if you're not fully present and you're doing this thing that we call dissociating, then there's some issues going on. But we want to make sure it's safe, and we want to make sure that they're fully present. And so that's what's going on, is they're doing those things and going through that REM cycle. So obviously a side effect oftentimes is exhaustion, right? Because the body's like, well, I'm tired now, and I'd like to go through another REM cycle. I'd like to go sleep. And so sometimes that happens. It's not uncommon.
Okay.
The other thing is they're going through conflict, they're going through pain, they're going through difficult life events. But when they go through those events, they're not going through it like they would expect. They would expect it to be uncomfortable. When in reality, when we're working through these life events, especially these negative life events, it's met with comfort and connection rather than disconnection and hurt and what was present in the past. And so it's establishing a new connection. It's becoming more adaptive rather than maladaptive.
That in terms of what they would act out upon if they were triggered outside of the office setting or outside of a safe setting. But are you saying that they we talked about how you spontaneously had a memory. Are these planned memories, or are they spontaneous memories that happen? How does that factor in?
So that's a hard question because both happen
Well,
at
that's
times.
what I figured.
So when we go into a session, we do it in a method. We have a methodology to it,
Okay.
where we are picking memories and events associated with the issue.
The issue being, give an example.
Let's say that you're coming to me because you have a fear or an intrusive thought of a past event. So let's say your past event, let's just say a gunshot wound or a car wreck. Let's do that. I get that a lot. Okay. You were in a car wreck, and every time you enter the car, you have an intrusive thought. You can't even get into the car anymore because of a past experience of 6 months ago. You had a car wreck. Okay.
Okay.
So you come to me and you say, I want to work on this issue. I can't drive.
It's
I say,
interfering with
great.
the
Tell
activity.
me when that
behavior.
started. Oh, this happened when it started when I got into the car wreck. Great. That's a memory that showed up. We will have that on the list.
Right. Okay.
That's a single episode right there. Then oftentimes what we do, and we do it all the time, is we look back into the past. And we're trying to see if there's any other memories that show up that are associated with that similar feeling or the similar belief pattern. Oftentimes that belief pattern might be, I'm not safe. And that car wreck wasn't the first time that you felt I'm not safe in your life. And so we're looking at other maladaptive events, memories in the past, I'm putting quotes on that, where you might have felt unsafe. And we're going to see what your mind comes up with. And that it's a process we go through early on in treatment where we start listing those things and making connections. And then we go in and we process each one of those events. Now, here's the deal. Sometimes we get into an event or a past memory, and spontaneously another memory shows up.
Mm-hmm.
Then sometimes we stay on track or we move on to that new memory because it's connected and it needs to be cleared out before we can continue with the original memory that we came into the office to work on for the day.
You, as you said you've done before, go with that.
Yeah, just go with that. Exactly. And that's the spontaneous part of allowing your brain to do what it needs to do consciously. And it's amazing what type of connections the clients come up with and the thoughts they come up with. And that's the wow factor, because sometimes they'll say, I never thought of that before. I never made that connection before. I never realized that how my mom and dad responded to me in a certain way and how that's connected with how I responded to the car wreck.
It's that aha factor that I often get when I start, when the client and I together do our investigative process of putting things in a timeline and looking at, I can see how these things are connected and related.
Yeah.
And it sounds like you're also talking about repetitive patterns of the reaction of the body.
Right.
Having the physical and
that's another aha moment.
sensation.
Every time I don't feel safe or I have this belief that I'm not safe, my body does this. I never realized that.
Bam, it takes you back.
Yeah.
Yeah.
Every
Okay.
time.
So the wow factor that they feel when they're walking out of the office and when they have said, wow, that was amazing, that is the aha factor as well. And it's just that sense of, I get it.
Yeah.
Or the client is able to say, I get why these things are happening to me.
Mhm.
Okay. So let's go to a question that I have. How do you offer this sense of safety that we all talk about, that as therapists we're supposed to offer a sense of safety and unconditional positive regard and all of the types of things that would make a client feel that there's not anything threatening happening when these, well, they're allowing you to help them access things that could be very uncomfortable for them.
Yeah. So the first thing is we're going to do the same thing that other therapists do at the beginning of the session. We're going to do history taking. And during
How much of that do you do? What?
I usually spend a session to a session and a half, usually.
Okay.
But here's the deal. History taking also happens throughout the entire time of this process because I learn something new every time.
Yes.
But during history taking, that's also a time where clients, I give them an allowance of being able and acceptance of asking questions at any time during this process. And so during history taking, I'm letting them share, but I'm also giving them information what EMDR is. So when I'm doing history taking, I'm also doing psychoeducation at the same time. I give them breaks. I let them share, or ask questions about them. And I'll do that for about 20 minutes. And then I allow them to take a breath and I share how EMDR impacts what it is they just told me. And then I allow them to share again, and then I give them more information. Then I allow them to share. And so it's just a back and forth.
So there's a lot of what would be considered traditional therapeutic work in an EMDR session. It's not just all cut and dry eye movement and
We don't even get to
process.
eye movements until maybe even the third or fourth session.
Right. That's what I wanted you to bring out, because I wanted
You're not going to come up and expect your body to say, okay, my body's ready. Let's go ahead and process these events I've got for you. Okay, the first event I want you to process is this, the car wreck. Let's get it going.
because I want people to have an understanding of what the process is, as opposed to having an idea of, I'm going to step into this procedure and I'm not going to know step by step exactly what we're going to be doing.
Yeah.
It's like we've talked before. Well, I'm going to have surgery. Well, let's go a good surgeon needs to explain step by step what they're going to be doing.
Right.
So in terms of what we do, and since you and I have worked together, we know a lot about what the other person does, and we have communicated quite a lot in terms of what we're doing in our sessions. And a lot of times in the past when we've worked together, we have jointly worked with a client. And so there's been a lot of communication. There's been a lot of collaborating back and forth. And plus there's been a really strong connection in terms of the client being able to see us as partners working together for their benefit. What kinds of information do you need after we sign a release of information? Because everything has to be covered in terms of making sure that we have permission to talk to each other, and that has to be done in writing. And so what kind of information do you need from me ahead of time?
So one of the things that's great about it is when you send me information or you talk to me, we're going to have a better understanding of the issue. So we won't have to do any field work or any investigation on what the issue is. Hopefully by the time you've gotten to me as a therapist that's referring a client, you guys have the issue, you're aware of what issue you want to deal with, right? It's very specific.
We've already covered from birth to present.
Yep. And so that's helpful. So that will make the first session a lot quicker with the client. Because you're gonna be giving me information that I'm gonna call and ask for. You know, I'm gonna ask what the issue is, when it began, and just really specifics around that issue. How long has this person been seeing you? What does this person hope? What have they told you what they hope for? I'm gonna be getting your perspective.
Okay.
You can, a lot of times you'll be able to share the details. Let's say it's a single episode trauma, a car wreck. You're going to be able to share the details with me about the car wreck where the client might not be able to or might not want to. And so all I have written down on my piece of paper with the client is car wreck. And I don't have to go through the details with the client. We both know what the client's talking about because I've spoken with you about the details as well.
So in other words, the work that the client and I have done together, and we have gone through, we've identified a lot of different things in their life, but this one big thing just keeps coming up. And it's just a hump that they cannot seem to get over with what is, they're just it's a constant barrier. And so we look at you doing the specialized work for a particular, as you keep saying, issue. Am I on?
You're tracking.
Okay. And so how do we, the two of us, now that we are well, at this point in time, we're in two different states. So that, but you have.
Yeah, that complicates things.
Yeah, that complicates our referral process now. But for therapists that are referring to you in your state of practice, how do you go about linking the relationship that you have with the therapist that they are seeing their primary care person?
Yeah, so you're asking, how do I get connected? How did I establish a relationship with the
therapist? How do you convey that to the client? That you and their primary care on the you as an EMDR specialist and their primary care are on the same page.
So I tell them, we've got a release of information here signed by you. Of course, you can remove that at any time. But a lot of the clinicians I meet with, I have Friday meetings with that clinician where we're discussing how things are going.
So you're having team meetings. You're having like team meetings where y'all are really trying.
I do. That's what I do on my Fridays.
And communicating.
That's what I do on my Fridays. That's when I'm usually talking to clinicians on Friday. So I don't see clients on Friday. I see clinicians on Friday. I also see clinicians. I also have clinicians that, this is great. I mean, it's not crazy. It's actually fully clear here that I have clinicians who have sent me clients, seen the work that was done to the client, and then the clinician ends up seeing me.
Okay.
So that happens too. But anyway, so I see the clinician on Fridays. We go over the work because on my second session with my clients is I'm making sure that there's stability and that there's resources and coping skills there. And so I'm also going over that stability and coping skill with the therapist and making sure that they're using that with the therapist.
You're making that bridge from one
I'm also
therapist to
making,
another.
yeah, and I'm also seeing what skills are you as a therapist using to help with the coping and stabilization of this client. Because I want to use that same skill. I don't want to teach a new skill that may or may not work. I want to teach a skill or use a skill that's already working.
Right, and that will not be a conflict. Now I have a major question for you. How do you get the therapist that have referred to you? How do you coordinate getting them to talk to you on Fridays?